If you look at the university's cancer research as assessed in the last research assessment exercise, which is a national benchmarking process, our cancer research scores were every bit as good as Oxford, Cambridge, Imperial, whatever. They're internationally competitive, is the first thing. The second thing, if you look at the most recent assessment of the Cancer Research UK trials unit based in the university, it was rated as outstanding by Cancer Research UK.
We have well-established multidisciplinary teams, and this is crucial for all of the sites that we'll be looking at patients for proton therapy. When somebody is referred for proton therapy, it is crucial that we don't just look at whether or not they can have proton therapy. What's important is we look at all other aspects of their disease, and that includes things such as a surgical opinion, opinions on their imaging, and opinions on their tissue diagnosis.
The best outcomes will come by careful dialogue and exploration of all of the variables within that team. Well, that team is already here and is already working. We don't have to set that team up. We don't have to bring people in. That's a huge strength for us.
They deliver the best for the patients. They deliver high quality, first class, world class medical care, and they're doing it within the financial constraints in which they operate.
We have one of the largest clinical trials, concentration of clinical trials in Europe. So there is activity going on here, which is of value to the local economy.
Linked to it, we've got facilities for tissue banking situated in a facility that's being constructed at the moment on the campus. We've trebled the number of cancer trials open, we've doubled the numbers of patients recruited. The contract to run the children's cancer trials for the UK was just recently put out to tender, and we won it in a competitive bidding process against all of the other trials units in the country.
Birmingham University Hospital Trust is a world centre of excellence in many ways, but as a hospital it is deeply and firmly rooted within the community in Birmingham, and the charities which are supporting this bid are a reflection of that local commitment.
This institution, jointly, University of Birmingham, UHB, was the first recipient of the Cancer Research UK clinical centres, first designated. Now that says something about the reputation for both cancer clinical care and cancer research and indeed clinical trials.
We work in very close partnership between the Children's Hospital and University Hospitals Birmingham. We can look after people between us right from when they're born until death, so whatever cancer cases come up, we can look after those people.
We work very well with University Hospital in Birmingham. They provide a lot of services for us. Their clinicians interact very well with us. Their oncologists, the radiation oncologists, the clinical oncologists work part of our team. We're really almost a seamless partnership.
%98% of the UK population can get to Birmingham within 4 hours drive time. There are more direct connections, rail connections out of New Street than any other rail station in the country. So that's really important for somebody, for a family that has to think about moving their sick child to somewhere for treatment of this kind.
One of the real benefits of our plans for proton radiotherapy is that the centre would be next door to and incorporated into our current radiotherapy centre. That's incredibly important so that we are fully integrated into normal radiotherapy and all of the other aspects that coexist between proton and normal radiotherapy.
If we want to locate it in a place which is both geographically central, but also central in terms of being adjacent to university, adjacent to other hospitals in the area which are doing good work, I couldn't think of a better place where it is right at the heart of a diverse, world-class medical community which serves a diverse population, so it's got to be right to be here.
Start to take this off now so you'll feel the clips. Okay, well done.
We are already acknowledged as one of the major cancer treatment centres for the UK. A proton therapy unit would add to the ability that we have to treat patients and treat patients successfully.
One of the main strengths of University Hospital Birmingham is in treating sarcoma, brain tumours and paediatric tumours, which are the mainstay of proton radiotherapy treatment. The key in all three sites is that we are regional and national experts in treating all three of these tumour types.
The University Hospital Trust in Birmingham has just completed a 600 million hospital rebuild, which involved decanting one hospital and then rebuilding it, building this big hospital whilst the other one was still operating. And they've managed to achieve that within budget and actually coming in before time.